Hey guys, so a lot of you asked for a sort of overview and advice kind of video for the rotations in year five. So I'll start with OBGYN, and then hopefully in the weeks to come, I'll do the other rotations as well. And I'm sorry if it ends up being late. It's just that I'm studying for iPhone 2 at the moment, and so it'll be a bit difficult, but I'll manage. Like, I'll try to get it out for you guys as soon as possible. Um, okay, so let's start with the OBGYN rotation. So, overall, I would rate this rotation a very high rating. I'd say like it's 9 or 10. And it's like a lot better than I expected. I don't know. I feel like I went into this rotation kind of dreading it, but came out like, oh, I wish I had more fun during it because it's just so organized. It's like one of the better rotations, in my opinion. Okay, so let's just get into the overview of the system. I'm sorry. So overall, you're gonna be put into one of the 5 teams in the like in WWRC. So in the whole OBGYN like hospital, there's 5 teams, and each team has like a different set of consultants. But then the specialists and the fellows and residents, they kind of circulate between the 5 teams. You are going to be put in one of those 5 teams, and honestly, all the 5 teams are really, really good. Like everyone that I talked to, they like really advocated for their team. Like whenever I'd ask, like, oh, so who's the best team, they'd be like, definitely mine. So all of them are very good teams. I was in team 4, which is the team of the clinical director of our rotation. So I was like very closely, like I did a lot of like rounds and things like that with him. So that was the plus point for team 4. But all of the teams are really good, and you're given 2 educational supervisors who are in that team. So you're given 2 consultants, and by the end of the rotation, they have to like evaluate you. Like someone has to evaluate you. You can get 2 evaluations. One of them has to be from like one of your supervisors, but the other one can be by any consultant in your team. So, for example, if like your supervisor is really busy and is not able to do your evaluation or something, you can always give the evaluation to another consultant who's willing to um, who's willing to evaluate you, and like maybe you just happen to spend a lot of time with a specific consultant and so they can evaluate you, then it's fine. Okay, so yeah, 5 teams, and each team has a different schedule, but every team has 2 clinic days. One day that's OT, one day that's labor room, and then one day that's like grand rounds kind of thing. So for example, for my team, Sunday was the OT day. So all the other 4 teams, they had other things on Sunday, but my team had OT. And so you see a lot of C-sections, you see a lot of like oophorectomies, my like hysterectomy, stuff like that, like fibroid removal, stuff like that. Um, okay, so so one day is gonna be OT, and then 2 days clinic. One day is gonna be the labor room, which is like all the kind of healthy moms who are about to give birth. Um, you basically you spend a day there, so it's just like a morning round kind of thing in the labor room, and then all the consultants, they just like stay in a specific room, and the midwives, there's like a midwife for every room for every patient, and they're the ones who like kind of do most of the work, and then the residents, they'll do like episiotomies and stuff like that. okay? And then you have 1 day of rounds. Now, every week, each team has like a designated specialist, consultant, and resident who are going to be doing the rounds for the inpatient that whole week. So, and then, but the consultant is not always going to be there. Like they're going to be there maybe once or twice in that week, but it's like mostly the specialist and the resident who are like assigned for that week to do the inpatient rounds every day. So, out of the 9 weeks that you have, 2 of those weeks you have to spend in inpatient. And so, what we were thinking initially was, oh, okay, so because the rounds week is only going to be like morning rounds and then you get to go home early, we thought, oh, okay, so the last 2 weeks we're just going to do the rounds so that we can go home early and study. But that's actually not a good strategy. The better strategy is every morning on Sunday, see, like, you know, the nursing station and the inpatient round in the inpatient ward. There's gonna be like a list that will say like who is the specialist and the resident for each team for that week. And if you notice that it's like a resident and a specialist who likes to teach, who likes to involve students, do your ward week that week. So don't do the, oh, last week I'm gonna blah 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 blah. Instead, yani try to make use of these like inpatient rounds weeks, and like do it on weeks where the doctors will actually teach you. Okay. And then also, you have morning reports, but you don't have to go to every morning report. The morning report starts at 7 a.m., but you only need to complete like I think 15 morning reports. But I think our clinical director, like we told him, like we don't really benefit from these morning reports, so he said he'll make it less. I think for you guys it might be 10 or 12. So if you finish these morning reports early on and you get them signed off, like basically every time you attend a morning report, when you're done with it, there's gonna be like someone who's gonna like sign for you, who's gonna sign like the paper for you, and then once you're done with your all of your morning report signatures, you can just give it to Miss Cookie, who's like she's the one who kind of takes care of all the scheduling, all the attendance, and all of those like paperwork and stuff like that. She's the one who like takes care of all that. She's amazing. You can always go and ask her for help. But yeah, so I'd say finish them off early on. And also, the morning report is not there on Monday, but that's fine because on Mondays in the morning you're gonna have 2 lectures. So every Monday you have 2 lectures from 7 a.m. until 9 p.m. 9 a.m. So 7 to 9, 2 hours, you have lectures. And then on Tuesday, you have lectures from 12:30 to 2:30, I guess. Yeah. Oh, wait, maybe it's 11:30. I forgot, but it's like in the afternoon. So Monday, don't go to morning report, go to your lecture. The rest of the days, go to your morning reports and try to finish them off as early as possible. And then, yeah, so once you're done with all of your morning reports, خلاص, you don't have to worry about it for the rest of the 9 weeks if you finish it early. And then also, you have 90% attendance. So if, like, alhamdulillah, with this rotation, it's not 100% attendance. So if you miss some days, it's not an issue. Like, they won't say anything. But also there are like certain strategies, or like there's like certain things that you can do where you can decrease the number of days that you have to go to the hospital. Like, for example, if you do a morning, let's say you do morning clinic, and then after the clinic you go to the labor ward, which the labor ward is 24/7. So if you go to the labor ward in the afternoon, you can get a second stamp on the same day. Like you can get two stamps on the same day. So then the next day you don't have to come. Or you save that extra like day that you don't have to come to the very end. So then in the last weeks, if you've accumulated enough stamps, you don't have to come at all in the last weeks. But also keep in mind that there's going to be lectures on Mondays and Tuesdays. So you have to come every Monday and Tuesday for the 9 weeks anyway. So what you can do is on those, like on Mondays and Tuesdays, you can do double shifts. Like you can come in the morning, do, let's say you have OT in the morning, and then in the afternoon you do something else. Like you can go to the emergency. Like see, in these 5, there's no emergency. But like some of the like most important things that I learned in OBGYN was in on-call in the emergency like area. So definitely go there. And also on-calls are really useful because there's not that many doctors or patients, and somehow all the crazy cases come during on-calls. So you'll get to see like the initial things that they do. Like once I did an on-call with the clinical director, and we saw a case of preeclampsia. And so like I learned firsthand what you're supposed to do when a patient with preeclampsia comes. Like what are you supposed to order? What are you like what is the like what are the steps that you need to do for this patient? And then in the end, like in the OSCE, we got a preeclampsia case. So it was like it was really useful. The on-calls are really useful. Okay, so that's the overview system. So how do you study? Like what are the resources that you need? First of all, obviously UWorld. You have 523 questions in total for UWorld OBGYN step 2. And so what you can do is you can, oh, we'll talk about that in a bit, okay, for how to study. Okay, and then also you have 20 lectures in total. I think it's maybe a little bit more than that, but it's like 20 something lectures, and it's honestly that's really good because you don't have that many lectures in total, but the lecture quality is really good, and you actually learn, you actually focus. Okay, and then also each student is assigned a specific lecture, and you basically, before the lecture that you're assigned to, before the doctor starts, you present a case that you saw for that lecture. Like for example, it's preeclampsia. So and you were assigned for this lecture. What you do is like find a preeclampsia case, any like in the hospital, or ask a doctor like, have you recently seen a preeclampsia case that I can take? And then you do like a quick 5 minute or like 3 minute presentation where you talk about this patient and what happened to them, using like a PowerPoint kind of thing. And then yeah, so you basically just give an overview of this patient and what happened to them and what management was given, just to give everyone an idea of how like how this kind of patient presents, you know. And if you don't find it, like if it's like a really rare thing like shoulder dystocia or something, like you rarely see that, what you can do is either, if you really, really want to find a patient, go to the labor ward and ask the nurses, like, oh, did you recently see a patient with shoulder dystocia? Or whatever, like vasa previa. Vasa previa is like so rare. So like no one sees it. So in that case, if you really cannot find any case, you can find questions. Like you can get questions from UWorld or Amboss and just present those and say, okay, so here are some cases. And then you just like explain the question. You go through all the options and stuff like that. And you kind of give an overview. If it's something, if your topic is like stages of labor or something, you can just give a short overview of the topic that's to come, like that the doctor is going to explain. But importantly, it's only supposed to be like 5 minutes long. Okay, and it's supposed to be for fun. Like you don't get graded for it or anything like that. It's kind of like a PBL kind of thing. It's really fun, honestly. I thought it was really creative and cool. And then also you have OSCE practice sessions. You have one at the beginning of your rotation and one at the end. And then also, um, so the one at the end is like close to your exam, so that's good. It'll like kind of prepare you. And then also you learn a lot from the hospital itself, um, especially in places like the labor ward where the consultants are not really that like involved, and so you can involve yourself, just like stick to a resident and just see what they're doing, and it actually puts a lot of things into context. And then also there's this YouTube channel that's really really good. Her videos are very short and they're very useful, and like they tell you exactly what you need to know, and so I really recommend watching her videos. Yeah, okay. And so now, how do you study using these resources? First of all, before you start OBGYN, or like when you're early on, watch some of her like important videos, or like before every lecture, watch her video that is like connected to that lecture. Or you can also just watch your regular online med ed or boards and beyond. It's like, it should be good enough. And then UWorld, because it's like 523 questions, you can do 20 questions every day, and like on the weekdays, and so that would make 100 questions a week. I know 20 questions not that much, but it will be really helpful, um, if you like actually analyze your questions and actually analyze where you got it wrong and stuff like that, and restudy them a lot. And then, so because it's 500 questions, if you do 100 questions every week, you can finish, the whole question bank in 5 weeks, and then you have 4 weeks left to do like a second run on maybe just your incorrects, or just the question that you flagged or something like that. Or you can do the whole thing because you've done the questions and you kind of know the information and stuff. You can do a block every day, or like a block every other day. It should be good enough. And then on weekends, study the topics of the lectures that are gonna be given in the coming week, and like always revise your incorrect questions. Um, that's very important. Focus on your weak points. Okay. And then also for your like content, what are you supposed to study for OBGYN? There's a really good handbook, and this is just a part of the handbook. And it's basically like 10 things, as you can see. Yeah. So it's like in total, 11 things. And so like you kind of just, every time you study something, just check it off. And yeah, it should be it this is like all you need to know for your exam. These like 10 things. And you're going to be given this in the handbook. You're going to be given this list of stuff in the handbook. Okay? Now, how do you study in the hospital, or like how do you benefit from being in the hospital as much as possible? When you're in the clinic, go to the doctors that you know. Like, obviously, the first week it's going to be a little bit like getting used to and stuff like that. But after a while, you're going to figure out what doctors in your team are like happy to teach, and what doctors are not so much. And so based on that, go to the clinics that will actually benefit you and you'll like learn from. Um, so um, so yeah. And then for me, the mistake that I made was that I would always stick to my supervisors. Like I didn't want to, like I wanted them to know me as much as possible, so that like I'd get a good evaluation at the very end, but it really doesn't matter. Like a few sessions with them is enough for them to know what you're like, and they're gonna see you a lot because you're designated to one team. Your team after 9 weeks is gonna know you really well. So don't worry about the, oh, I need to go to the clinic of my supervisor, otherwise they're not gonna know me, and so they're not gonna be able to evaluate me. Like, do it enough. Maybe because you have two clinics, you can go one once every week with your supervisor, and the other clinic go somewhere else. But if your supervisor teaches a lot, then khalas, stick to that supervisor. But in case your supervisor is not, you don't learn that much, just go to any other doctor, go to any other clinic, and see like if they teach you and stuff like that. Just go to them. Okay. And then also, I found that whenever I was like in a male doctor's clinic, the patients would let me examine them a lot more often compared to when it was a female doctor. Sometimes when it was a female doctor, they're like, they would want the doctor to examine them, even though usually it's the nurse who does it, but like they would want the female doctor to do it or whatever. So I felt like I was a lot more hands-on when I was in a male doctor's clinic. And then labor ward, you're gonna have like a morning round, just like all the consultants going over every patient, going to see like if they're okay, if everything's good. And then after that, you can get your stamp and you can leave the labor ward. But also, like if you want to see normal deliveries, or if you want to like you want to take history and practice and stuff like that, you can always like basically at the nurse's station, there's like a TV which has like an Excel sheet of all of the patients that are in like all the patients that are in the ward. And then you can see like how many centimeters each patient is dilated. And so if you see like 9 centimeters or 10 centimeters, go to those patients. And if they're like happy and stuff like that, ask them like, hello, like introduce yourself and everything, and then be like, is it okay if I ask you a few questions, and then be here for your delivery, just to like support you through it, and just like, just like be here and stuff like that. Sometimes they'll be like, yeah, of course, like, like, of course you can come and stuff. And I feel like when you're a guy, it's a little bit difficult. So if you find it difficult, don't waste your time, just go home. um like realistically, I know like it's not easy to like go in and stuff like that, and like a lot of guys are not that interested in OBGYN anyway. So you like after your round, you can just get your stamp and you can go home on labor ward days. But I feel like the guys enjoyed the OT days more, because it's like the patients are under sedation. Like sometimes if it's a C-section, it's usually just like it's like a lumbar, you know, anesthesia or whatever. So they're still like awake. Um, so but it's fine. Like you can scrub in more in the OT. I did not like the OT, because I feel like the doctors are so stressed out, and like the whole hospital is just so understaffed. And so they're always just stressed out and they're always really busy. And sometimes I would scrub in and it would be fun, but it's just like I didn't learn anything and I hated my life in OT. So if you can, do like the on-call thing, like get two stamps in a day, and then don't come on the OT days. That's what I would do personally if I could like turn back time. And then also in the orientation, they're gonna tell you, oh, in the OT day, come at 6:30 because you need to get your scrubs, blah blah blah. That's not true. Like, no, you don't have to come that early, and you'll still get your scrubs and everything. Like you'll be fine if you come at 7, if you come at 8. No one cares. No one really cares that much. Maybe on the first day you can come at 6:30 just to like, show like give like a good impression. But other than that, you can come in late on OT days and it's not going to be a problem. Everyone's wearing a mask. Everyone's like dressed the same. No one's going to know you like, oh my god, you came late or whatever. Like it's fine. You don't have to do the 6:30 thing, okay? And then I already talked about about the round thing, but like 2 weeks out of the 9 weeks, you have to do inpatient rounds. And so, like every Sunday, kind of check if your resident and if your specialist is going to be a good one and is going to teach you, and go to your your inpatient round on that week. Okay, so that you can make the most of it. And then obviously on calls, you can get 2 stamps in one day, and then you don't have to go any of the other days. So that's good. Like vary it. You can go to you can do on call in a lot of different places. Like you can go to the labor ward, you can go to emergency, you can go to the inpatient. I think they do like a round in the afternoon. I'm not really sure, but just like check. But yeah, emergency is a really good place. There's like they teach you a lot over there. They let you be more involved because there's less doctors, and so they're more focused on you. Um, and yeah, I feel like on calls are really good. Sometimes actually you don't have to come in the morning if you don't want to. You can come in the afternoon. Like some people are just not morning people, or some people just want to study in the morning. So unless you have lectures, you can come in the afternoon, like at 3 p.m., and then leave by like 6 p.m. Get your stamp and then leave by 6 p.m. Or if you want to stay, I know people who stayed until like 10 p.m. because they just really liked OBGYN. So if on a day you don't feel like coming in the morning and there's no lectures and you're not behind on morning report signatures, you can just come at 3 p.m. and do your on call at that time. Okay, so the final written exam is very similar to like UWorld, but it's like the vignettes are shorter, so that's good. And then also the session, like basically the clinical director gives you a revision session at the very end, just before your exams, and so you kind of understand like, okay, what is like his style of writing questions. Basically, you have to really focus on the last part of the question, like the last sentence. It like tells you what they really want. Like, is it like, what is the most, for example, risk factors or whatever. The question could be, what is the most common risk factor, or what is the most significant risk factor? And so maybe like there's a risk factor that very strongly associates with this complication, but it's just not very common. So you have to see, does the question say what is the most common, or does it say what is the most important red flag risk factor that you have to like consider, you know? So like kind of those like nuances, the doctor goes over it in the revision session, so that's good. Okay, and then OSCE, again, like at the beginning of your OBGYN rotation, the first day, or the second day actually, you get like a full day of what's it called? You get a full day of sort of OSCE practice, like history taking, communication, obstetrics exam. You get taught like how to do the full obstetric physical exam, and then also in the OSCE they're gonna expect you like some of the stations. Like for me, for my OSCE, there was a station for C-section, and you had to explain the procedure to the patient, and then you have to explain the risk factors and everything, and then you have to like write everything out in the consent paper, and you have to show the patient where to sign and stuff like that. So when you're in the rounds or when you're in the clinics, if you see like consent forms being filled and stuff like that, you like kind of see like what do they write in the complications section, what do they write for like different procedures, you know? And then also for OBGYN, you're not gonna get an oral case presentation. Like you don't have to do an oral case presentation like all the other rotations. It's actually a case-based discussion where it's kind of like OSCE. You go in and then you read like a paper, like you read a case, and then there are like certain questions that the examiner is gonna ask you, and then you have to answer. It's kind of like a GCSE thing. Like you have to say, let's say, 5 risk factors of preeclampsia or something. And then if you say the 5, خلاص, you get the full mark. And the examiner is only allowed to say the question, and that's it. Like, they're not supposed to talk back to you or anything like that. It's like very standardized kind of CBD kind of thing, okay? Um, okay. And then other things, like in case you're interested in like the OBGYN residency, do on-calls with the clinical director. I was in team 4, so it was kind of easy for me, but everyone can. You just like, there's like a schedule kind of thing that you ask for, like, I don't know, ask the doctor, like ask the clinical director, could you send the schedule for like the consultants being on call, and then go to the on-call with the doctor for that day. And you actually learn a lot. Like, mashallah, he's like one of the best doctors that I have like learned from, in terms of communication with the patients, body language, like team sort of, like teamwork and stuff like that, like how to organize your team as a leader kind of thing. A lot of things, honestly. um, yeah, and then knowledge, of course, yani. Okay, and then also, if you do a lot of like on calls and stuff like that with the clinical director, then he always has these kind of like presentations or like conferences and stuff like that, and he can find you like seats to go. And so if you go more to those things, then obviously you learn more in about OBGYN, and then also the doctors around you get to know you more. And so also you can get like research opportunities through that. So I guess that's like your in. This is like your in to the extra things in case you're interested in OBGYN residency. And then good luck and have fun. Honestly, it's a really good rotation. It's organized very well. The clerkship director is very involved. You can always contact him. You guys have like a special room, like the students have a special room for them where you can like put your snacks and stuff like that, and you can just like, you know, whatever, like eat it whenever. You can study there if you don't have like a place to study. It's honestly like really good rotation. And also, you don't have to like keep introducing yourself throughout the 9 weeks to different people, because you're gonna be with the same people for the 9 weeks. So yeah, have fun. And yeah, that's it. See ya, bye.